Subscribe to our YouTube channel and press the bell icon to get the latest updates.
Well, ma'am, thank you so much for talking to us here at ThePrint. Let me start with first wishing you and all your family safety, because at this time, it's a very trying time for all of us. But straight to the questions. I'd like to ask a very Karnataka-specific question first. While we see the situation in Karnataka with the government partially opening up certain sectors and certain green zones, North Karnataka, the effect of the virus does not seem is going unabated. What do you think is going wrong there? Do you suggest more random testing in those areas?
See, Rohini, the way I look at Karnataka data, I think it is not alarming. Let's put it that way.
Okay.
Secondly, I think we need to understand the difference between just getting positive cases and then tracking deaths or the severity of the cases. So as long as we don't see people getting into ICUs or dying, I think we should not really worry about the numbers of positive cases that we are tracking.
Okay.
Remember, we are a relatively young country. You know, the demographics of our country are working to our advantage. 90% of our population is below the age of 60. And as you know, globally, 80% of deaths are actually ascribed to people over the age of 60. And not just that, I think we must also understand that even the deaths we are seeing in Karnataka and across the country are again largely in that age bracket of 60 and above. If there are people who are, below that age bracket, we also have to look at the comorbidities, because many of those people also come with other comorbidities like cancer, diabetes, renal disease, and lung disease. So, and if you look at the number of 650 or thereabouts, and the reported positive cases of 21,000 plus, I think we are not really showing a huge number of what they call the test positive rates, the TPRs, right? We are at roughly about 4.5% as compared to the US, which is almost 20%. And, Spain is almost a little over 18%, and even Japan is double of India.
Yes.
Why is this the difference? Because remember that Europe has an aging population. India is a young country. Secondly, you couple this with our exposure in Asia and India to zoonotic viruses, as we call them, and even to SARS, okay? As compared to the Western populations, which have really very little exposure to zoonotic viruses. That explains why you have seen such serious, ramifications of COVID-19 in the Western world as compared to Asia and India. If you look at the Asian data, it's very revealing. Even poor countries like Vietnam, Bangladesh, Pakistan, and Thailand, the death rates are so low. You can underreport testing, but you cannot hide deaths. So I think we have to pay heed to these kind of data points. And I also believe that in a country like India, we should really focus on removing the social stigma associated with testing positive. That is a very, very serious problem we are having in society today. And that is the paranoia and the fear that we have to remove from society. Just testing positive does not mean life and death. Because you know that most of the people, 90% of the people who are testing positive are having mild and asymptomatic kind of conditions. And they're coming out of this very easily. And good is that as you see more and more people being discharged from hospitals after they've recovered, you're also developing a herd immunity. So I think that's also very important for us to remember. And yes, there are people who are dying, but then you also have to understand that, like with every kind of disease, you will have a certain number of people succumbing to these kind of diseases. How many people are dying of TB? How many people are dying of even influenza? How many people have died of H1N1? Look, today I think we have many more people dying of dengue and other things that I've just mentioned than COVID-19 at this point. What is happening is that we are actually getting very alarmed from the inability of the Western world to deal with this virus.
Okay.
Look at, countries like the US unable to control it. When you look at Europe unable to control it, UK unable to control it, New York unable to control it. That's what sets the alarm bells ringing in the world. But if you actually step back and really look at how India has dealt with it or how Asia is dealing with it, I think you should get some comfort into knowing that we are much safer than those populations.
So are we testing enough then? Do you think we have done enough testing?
No, we have not done enough testing, but at least we are testing, people who are displaying symptoms. We are doing some random testing amongst the quarantine patients. We are doing testing in some of these red spots. Yes, we are doing a lot of those testings. We can do a lot more. I mean, there's no doubt about it. But, the point is we should be tracking the serious cases. We should be tracking the deaths associated with this COVID-19. Because what will really give us full confidence is if there's some treatment until the vaccine arrives. At least if there's a treatment that says, hey, by the way, this is working very well in COVID patients and we are seeing a very reduced number of deaths, that also gives you a lot of comfort. Right? And then, of course, the vaccine hopefully will give us the final comfort that, yes, now it's free. So that's the way I'm looking at it, that we are not in such a bad place. And I think from the 3rd of May, we should be able to open up without feeling so paranoid about what may happen.
That's some relief, because that's one of apart from the fact that you have people who are worried about how the spread of COVID would be, opening up is something that people are looking forward to, not just because it's also causing other issues, being problems that need to be addressed. But do you think that private bodies should be allowed to test for free if you get test pooling is made available?
Well, I think private companies should be testing, because I really think they ought to actually start assessing their own risk levels. So I think they must test in their workplaces, and do pool testing. Now antibody tests will also come out. So you should do a mixture of all these testings just to quickly assess how safe your environment is.
Yes.
And even if you get a positive case, there should not be an alarming situation. Those positive cases should simply be quarantined without having to shut down the operation. So that's the way I think we have to move towards a more saner kind of a approach to lifting the lockdown. Because right now, I think we are doing things in a very extreme way. One positive case, we want to shut down everything. Whether it's a hospital, whether it's a factory, whether it is anything. And then you are having this horrible behavior of people who are, attacking healthcare workers and anyone who's positive. I think that is a bit too much. And that's why there's a stigma. We must remove that stigma in society.
And disrespect to those people who have been affected too.
Yeah. And also we must remember, because people are scared, you're actually heightening the stigma instead of removing it.
Right.
So I think those are the kind of things you need to do.
But the lack of free testing, do you think this is edging upward also?
I think there is a total wrong message that is being sent. There is no question of lack of free testing. Today, you don't have to test everybody. Please understand that. Nobody tests everybody in the population. Today, there are enough free tests available for those who need to be tested. Okay, whether it's government hospitals, whether it's many of us are testing free, many labs are testing free. So there's lots of free tests available. It's not that there's a dearth of free testing, but you must also not put the onus of free testing on private diagnostic labs, because that's their business. On one hand, you want economic revival. If you want those people to be, alive and viable, you have to allow them to charge. right? And this becomes then a commercial proposition. I know many of these diagnostic companies have gone into a volumes game where they're actually making deals with government, state government, saying, okay, although we have got an MRP of 4,500, if you give us a huge volume, we will reduce the price. So those kind of negotiations are also happening with the private diagnostic labs. But it's unfair to say that the private diagnostic labs must charge free and was not charged. That is not right.
Okay.
I agree that people ought to get free testing. Who pays for it is the question. Should the government pay for it? Should the insurance companies pay for it? Why not ask the kit manufacturers to lower their costs? Because a large part of that cost is the cost of the kit. So I think there are lots of options open, and we should not just focus on one group of people who can't afford it.
Ma'am, you make an interesting point about by 3rd of May, we should now look at slowly opening up the lockdown. But Karnataka has 359 containment zones, 19 in Bangalore itself. So when do you see Karnataka flattening its curve?
No, I think Karnataka is doing very well. I mean, if you actually look at Karnataka's data, it has very few deaths compared to any other, most of the states of its size in the country. I think right now, I think we have about 15 or 16 deaths. I'm not exactly sure of the number.
17.
Okay, 17. And we have maybe about 400, 500 cases so far, positive cases. I think we are, the number of people who are positive is much higher. So if you were to factor that in, then please understand that this report of 17 deaths I would think that we are under, the number of tests that we are reporting are much lower. I mean, you will have many more positive cases. To basically extrapolate from some of the data that is coming from other parts of the world, then I think we are in a very safe place. Because if you say that you're under-reporting or under-testing by a factor of even 5, then to have 17 cases in 2,000 positive cases is a fantastic, statistic to have. And that should make you very safe, feel very safe. And so why has all this happened? Definitely because the government has been extremely responsive at the right time. So this rapid response that the government of India had to the virus is very, very commendable. So a combination of the quarantine measures that we took, the nationwide lockdown that we mandated, and the fact that we have these zoning kind of methodologies, where we are looking at places where there are a few deaths and zoning those off, I think have all augured well for us. And that's why you're seeing such a tight control. I mean, look at Kerala. Kerala is ready to open up its economy because it's brought in so much control. Karnataka also has it under a lot of control, and you should be able to open up. I would say that there are very few states in the country which really need to really do a lot more monitoring and surveillance before they really start opening up. I know Maharashtra is really, with Dharavi in particular, because Mumbai has the maximum number of deaths. Other parts of Maharashtra can be opened up.
But why I asked that question on Karnataka, I asked is Karnataka is in a unique situation. It is surrounded by states that have very high COVID cases, positive cases. Opening up even with Maharashtra, Kerala, Andhra Pradesh, Telangana,
but
Tamil Nadu.
Kerala is under control. I mean, we are very safe from Kerala's point of view. Even Tamil Nadu is not that bad.
The spike in Telangana and Andhra Pradesh and Maharashtra has affected.
Yeah, but as I said, I'm not so concerned about the spike of positive cases. I'm more concerned about how many deaths are
associated.
So I'm saying that as long as we have a good... See, look, there's not going to be much of inter-state travel. Okay, the travel is not there. You'll only have logistics into other states.
Right.
So from that point of view, you're again doing it in a calibrated way. You're not allowing travel, right? You'll have sort of calibrated travel. We must open up the travel sector, but maybe not immediately. Maybe by the end of May or early June, you can open up some of the travel. And maybe some flights, some trains may start opening up. I have no idea, but at least you can wait for a few more weeks and see how things are before you open up travel. Other than that, I think if you look at the economic activity, you can already allow it. I mean, why would you not allow the shops to sell products? Why would you not, create a new business model where, the mom and pop kirana stores will deliver to your houses? That's already happening.
Yes.
Why would you not allow, all these markets to open? Only thing is you don't want congregation of people too much. So for 1 month, you want to be a little careful.
Right. Go ahead,
So
ma'am.
therefore, I think companies can start. I think IT is already, working very well from home. But, companies like ours, which cannot work from home because of manufacturing and R&D, we are already working quite safely. And many, many small startups and things must be allowed to work. And I think you will start seeing that we have to bring back livelihood, right? Lives we've saved. Now we have to save livelihoods.
That leads me to the question I was asking about opening up sectors. The ITES sector, though they're working out of home, but do you think how much more manpower should be available? Workforce need to go to the offices, because right now they have not specified. It was 50% initially.
No, I think IT has already worked on this. They are quite ready to come back to work in a calibrated way, but they have figured out how to work from home. There are some sectors that can work remotely, but there are many sectors that can't work remotely, and those are the sectors that need to be revived. We can't afford people to stay out of work and not give them livelihood for months together, right? So now we're in a safe place because we've already finished 3 weeks of a lockdown. Now we are extending it by another 2.5 weeks. And by then, I think we should be in a very safe spot, because in this 5.5 weeks, we've actually, built a lot of knowledge, data, as well as a state of preparedness. Like, I'll give you some optics. And what has happened is that you will see that the occupancy of these hospital beds is only a small fraction of these 100,000 beds, which tells you that our hospital system is not going to be overwhelmed. If you look at the number of people who've been on ventilators, apparently the cumulative number to date is much less than 100. In fact, it's about somewhere in the 70s range. So that means we are not even going to be overwhelmed in terms of ventilator support, which the whole world has been challenged with. And then if you look at the number of people who are being discharged with moderate, levels of the disease, you can see that we are actually very resilient to this virus. So all that should give you comfort that, okay, not that nobody is going to test positive. I think if you look at that Santa Clara report that from Stanford University, they say that we are, most people are underreporting 85 times. They feel 85 times more percentage of the population is infected. So if that is the case, then we must be having so many positive cases. But what we should take comfort in is that very few people are dying. That number is akin to any kind of disease. Do we keep worrying about dengue deaths? Do we keep worrying about TB deaths? Yes, we are worried. We want to bring it down. But we are not so paranoid that, oh, this person has got TB and, oh, I better not go anywhere near that person. Oh, this person has got dengue. This person is a social stigma, has a social stigma attached. We don't have that, right? Because there's a way of dealing with these patients. And yes, some people die, some people don't. And the same goes for this. That yes, we will have a few deaths, but the majority of people are okay.
Yes. You were mentioning about a coronavirus blood bank, which I also saw. How important is it and what is this necessary for?
So, I think this enriched plasma therapy is a very old therapy. It's nothing new. This was even used during the Spanish flu time into 1918. And this has also been used during the SARS outbreak. This has also been used in many of these kind of pandemics or epidemics. It's a very old, it's like a natural vaccine. Let's put it that way. So what do? You take the blood of a person who's recovered. And You enrich that person's plasma because that person's plasma will have what we call as neutralizing antibodies.
Okay.
These are antibodies that specifically kill the virus. Okay, so if you concentrate those antibodies and you push it back into the patient who is severe, the hope is that those antibodies actually destroy the virus and the patient recovers. And since there's so much data available that it does work, you should be doing it. Of course, it's not scalable because you're dependent so much on the convalescent patients, right? And you may not have that many convalescent patients' blood to really use for this purpose. But the fact is, if you can get it, it's a good way of at least rescuing many of these very serious patients. So I think, I had discussed with many of these state governments that, you should collect with consent the blood of these recovered patients, because it will help you. Because tomorrow, if you do have serious cases, you can use this particular therapy, which does work.
Is this the same one that you're also assisting in terms of how the whole plasma transfusion procedure, especially to develop treatment for COVID-19, does this come down to even trials? Has this progressed up to trial levels?
I mean, it can be done as a trial, and I think this is done at a state government level with these principal investigators in those government hospitals. So whether it is Kerala, whether it is Karnataka, whether it is Maharashtra, whether it is Delhi or Telangana, these state governments are actually then asking for permission to do. And anyway, ICMR has also come up with a protocol as to how you should be doing it.
Right.
And they are then basically going to do these plasma therapies. This has been done in many parts of the country, world today. Already, US also has been trying it out. I know that parts of Europe have tried it out. I know UK has tried it out. Many parts of the world have tried it out already with very good results. But I think India also needs to be at least in a state of preparedness if you need to do that, because there are many serious patients who can be saved with plasma therapy.
Because we've seen some of the Tablighi Jamaat people also offering and saying they're ready to give their blood samples to enhance research or even help in creating. So is Biocon developing a vaccine, or is Biocon developing an anti-COVID drug?
So, our company Syngene is actually doing a number of things. So Syngene basically started looking at the diagnostic kits, the PCR kits. And we started realizing that even though we've got a lot of so-called indigenous kits developed, these kit makers are just assembling imported components. Okay, so we decided that we must indigenize those components. So then Syngene is helping to develop and produce a lot of those components at scale. Okay, so that's one thing. These kits require, the PCR kits require what we call as probes and primers. They also require enzymes. So we actually identified a few companies who can make those enzymes. Then we looked at getting into viral extraction, RNA extraction, viral transportation. All those need to be done locally. So we found a lot of companies. Syngene is one of them that's developing the most important part of those kits, which is the probes and primers, because that requires understanding the sequence of the virus and then producing that sequence as a probe or a primer. Then we started looking at the serological tests, right? Today we are talking about those antibody tests, and they're not reliable because, we've imported some from China and they're not working. And then US FDA also came in very heavily against those antibody tests because they were not done properly. So Syngene has a lot of capabilities in antibody products. So they started saying, how do we develop an antibody test for India? So they started developing a serological test. Right now we have what is called as an ELISA test, which means we can actually do that test in the lab. But we need also point of care antibody tests, which are more convenient. And there's another company which is able to do that. So then we are working with them to say, okay, we will give you some of the products that you need to develop those tests with. So there's a lot of effort going on. And then over and above that, we also know that, if you can actually duplicate or replicate those same neutralizing antibodies that are working in convalescent patients' sera for plasma therapy, if you can actually synthesize and make antibodies in a lab, in a bioreactor, that's much easier, right? Then you can scale up. So that's another approach to produce those kind of antibodies specifically for COVID-19, and that can become like a really effective.
Right.
So those are the kind of things we are doing. And we are also working with small vaccine companies who need our support. So we are hoping, that all these efforts will actually realize good success.
So, ma'am, how well is India placed to develop a COVID drug if you see ourselves globally?
Well, I'll go to two things. One is a COVID drug and a COVID vaccine. What is more important is the COVID vaccine. And I think India actually has quite a few groups working on this vaccine. And I think we should try and come out with our own vaccine in a year's time, is what my feeling is. And because there's so much focus on a COVID vaccine, I think we can actually use that focus to attract funding and develop these products. So I know 2 or 3 small companies who have got some really innovative ideas for these vaccines. And I think we should actually, they are being supported and they are being actually partnered with big companies. So I know that Biological Evans is partnered with one of them. I know that Syngene is trying to partner with one of them. I know Zydus Cadila is doing some development. I know that Bharat Biotech is doing something with the University of Michigan. So there are a lot of those efforts going on. And I, for one, feel that you will be able to get a vaccine, a made in India vaccine, definitely in a year's time. Now, coming to a drug, there are many drugs being developed. In fact, and many drugs which are being repurposed and many new drugs that are being developed. One of our own drugs, which is an anti-CD6 antibody, which has a very good potential of dealing with the cytokine release syndrome that happens in COVID-19 serious cases, and an anti-inflammatory effect on the nasal and lung passages, is something which we are trialing. So that is going to get into trials very soon.
Yeah, that leads me to my question on hydroxychloroquine, because the world is divided on its opinion of its efficacy. So do you see, and its side effects, so do you see the effectiveness of it? Do you think it works? And I'd also like to take the question on remdesivir. It has passed the monkey trial, so do you think it would be effective enough?
See, the point is that there's a lot of data to suggest that hydroxychloroquine is not really the wonder drug that everyone thinks it is. There's too many trials that is actually showing that it doesn't work as well as it's supposed to work. So there's a lot of anecdotal data to say that so many people did do well and so many people didn't do well. So, to pass the test, you really need to show very conclusive data. And yes, remdesivir has worked very well in open trials. Now we have to see how it works in the randomized placebo trials, right? Trials. Remember, remdesivir was not specifically developed for COVID-19. It was developed, it was tried for Ebola. It was tried for other kind of, viruses. So we just have to assume that it might work well for this. But is it the magic bullet? I don't think so. Okay. So I think all these drugs can be effective in certain cases, but they are not on their own going to solve the problem. So the only kind of therapies that can actually definitely solve that problem is that kind of antibody therapy that I talked about, or the plasma therapy that I talked about. That is the only sure shot sort of mechanism of action proof that it will work. Other than that, you just have to look at various kind of, rationales that people are using about, the ACE receptor and, the spike protein epitome and how it attacks that. And, those are a lot of those kind of things being given.
Ma'am, recently, as a part of the panel, you submitted a report to the Karnataka government. And this is about the national reopening strategy. I was looking through that, and you're talking about a calibrated reopening of sectors. We have discussed this through the interview today, but when do you think that we can actually look at reopening, and what kind of stages? Because interestingly, you're talking about states should be prepared to move from green zone back to red zone and back and back. So how
that is surveillance. That is surveillance. Actually, this report was written even before the 21st of April. I mean, before the before the 20-day lockdown was over. So it was actually written almost at the time when we started the lockdown on the 23rd or 24th of March. And what we did was we said, okay, now if you have to reopen after 21 days, how should we do it? So that was the time we said that it should be based on the threat level or the risk assessment of every zone, right? And so we decided to do zoning and say which is the red zone, amber zone, and the green zones. And we said the green zones should be allowed to operate fully, but you should prevent ingress into the green zones. You shouldn't allow people coming into the green zones. If you look at the orange zones, you can allow ingress and egress, but you should keep tracking what's happening in the red, orange zones. It's the red zones which have to be really sealed off. No ingress or egress into the red zones. And as soon as the red zones don't show any more cases, you can make them into an orange zone. And then soon, orange zone also can become a green zone if you don't see any cases. So it was all based on the number of cases or the positive cases you find in each zone. We are also saying that, if you find a positive case at work, you shouldn't shut it down. So, now even though you're in the orange zone, you should not be so paranoid about finding positive cases at your workplace. Because right now they're all saying that if you find one positive case, you should shut down the facility. That's not correct, because once you start understanding that it is not such a fatal disease especially for the young, then you should be having the comfort to operate.
Right. So on that note, when do you think schools and colleges should be opening up? Because now you said that you could open it for the youngsters.
Yeah. So for at least fortunately right now you have summer holidays.
Yes.
So I think in June you should feel much safer to open schools and colleges.
Because they've already started online tutoring, but they feel that July, August is when they're being, like you said, paranoia is taking over rather than...
I think end of June you should be quite safe to open up. Of course, we'll have to see what happens from now until end June. Hopefully, fingers crossed, everything will be fine and you can open up.
So to end this interview, one last large perspective question. How long do you think India should continue this lockdown or opening up in partial phases till July, August, or much earlier, or start opening much earlier?
I think we should start opening from May 3rd, and by the end of June, we should be fully operational. That is my view. I also believe that India must revive its economy sooner than later for two reasons. One is, as I said, we've saved lives, now we need to save livelihoods. We can't be in a lockdown for such a long time, we can't afford it, and people need livelihoods. The second thing is that the sooner we revive, we are actually going to be in a more advantageous position than other economies. Because remember, even other economies are going to stagger their revival. Europe cannot just suddenly start. US is going to take a much longer time to really revive its economy. So in the meantime, if we can start our economy faster and we can revive and we can actually deal with this epidemic, this pandemic, and we can see that we are very safe to actually bring back our economy to normalcy, then we will be in a very strong position. Now there is also an opportunity for us to, balance the China factor, right? We can actually bring a lot of the Chinese manufacturing to India. We can also start, developing. We've seen some of the capabilities that we've had in our latent capabilities that are now coming to the fore. We never made PPEs before in such large numbers. We never made masks. These are things which the world is now going to need at scale. So shouldn't that become a new business? I mean, shouldn't we be making masks for the world, PPEs for the world, ventilators for the world, diagnostics for the world, vaccines for the world? this is a big opportunity for us.
It definitely has opened lots of opportunities and told us what our capabilities are. Thank you so much, ma'am, for talking to us. And it's a pleasure. And like I keep saying, please stay safe. Thank you, ma'am.
Thank you, and you too.
Thank you.